The surgical team has completed the procedure, and they are preparing to close the surgical wound. The scrub nurse is counting sponges, sharps, and instruments with the circulating nurse to verify that all are accounted for prior to wound closure. Based upon the VA directive, Prevention of Retained Surgical Items, as well as guidelines from the Association of Perioperative Nursing, or AORN, counting practices should be standardized and conducted in the same way in all hospital operating rooms or surgical centers. Amy and Rob are counting sponges, sharps, and instruments together to reconcile their current counts with the counts from the beginning of the procedure. During the counting of instruments, Rob is following his count sheet that accompanied the instrument tray prepared by the Supplies, Processing, and Distribution Department, or SPD. When accounting for sponges, surgical nurses should use a method that is transparent for all surgical team members in the OR to see. Any additional instruments introduced to the surgical field during the course of the procedure should be added to the count sheet or listed on the whiteboard so each new item can be accounted for at the end of the procedure. While maintaining the flow of the operation, the surgical team cooperates with the scrub nurse and the circulating nurse to facilitate complete and accurate counting of all items on the surgical field.
I'm finishing up my wound exploration. I really think I got all the laps out of here. Do we have the separate film?
Yes, it's right here. Dr. Berger, please give Rob and I a minute to finish our closing count.
You know, we really need to get this guy out of here.
Okay. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Here's 1, 2, 3, 4, 5. 1, 2, 3, and 4. Dr. Berger, Dr. Albo, we're missing a lap pad. Would you mind checking the field, make sure it's not hiding somewhere?
Rob, I can't believe this. There seems to be an epidemic of missing laps in this OR lately.
Rob, have you looked everywhere? Did you check the floor, the kick bucket, the trash? Take a look again. I'm sure you'll find it. Amy, can I have the fascial closure suture, please?
Dr. Berger, do you think you could look in the wound for the lap pad before you start closing?
She's right, Dr. Berger. We've done 2 counts and still have a missing lap. I've scoured this room and haven't been able to come up with it.
I'll tell you what, David, they're right. Let's check the wound again.
Okay, Amy. Give me the retractor. We'll take another look.
When the scrub nurse reports a missing surgical item due to an unreconciled count, the first responsibility of the surgeon is to stop wound closure and perform a methodical wound exploration. Rather than just a quick look, the surgeon must carefully examine the wound with a visual inspection and a tactile exploration in an effort to recover the missing item, which is a laparotomy pad in this case.
Dr. Albo, I've looked everywhere and I can't find a lap pad. Now what?
Well, I'll tell you what, David, we have to get an X-ray of his abdomen. That's our protocol.
I've already called radiology. The tech said he'd be up in about 10 minutes. 10 minutes? I have patients in clinic and consults up the wazoo. I don't have time for this.
Well, David, our first responsibility is to make sure that this patient leaves this OR tonight without a lap in his belly. Everything else will have to wait.
An intraoperative radiograph is required at the end of the surgical procedure prior to wound closure for one of 2 reasons. 1, incorrect count of a surgical item. This means that the final count is not the same as the initial count. Or 2, when an instrument count has not been performed on the surgical field. An exception to the requirement for counting instruments would be for surgical procedures in which a retained surgical instrument is virtually impossible. Virtually impossible does not mean unlikely, because a retained surgical instrument is always unlikely. An example of a procedure that would be virtually impossible would be a skin biopsy. For medical reasons, the surgeon may decide to forego the counting of instruments and/or the intraoperative radiograph, which must be documented in the medical record. A portable radiograph of the abdomen was taken by the radiology technician and reported by the radiologist to the surgical team within 30 minutes of the request from the OR. A radiologist must review and report the findings of the intraoperative radiograph to a member of the surgical team within 30 minutes of the request. If the surgical procedure is done after hours, on a weekend, or on a holiday, the report must be made to the surgeon within 16 hours of the procedure termination.
David, they think they see something suspicious on the midline. They're not sure, though, and they would like to get another X-ray, this time on oblique view. Rob, could you do me a favor? Could you call the radiology tech back in and ask him that we need to get another X-ray of the abdomen, this time on an oblique view, please?
Sure.
The oblique film has been taken. Dr. Albo has just finished a phone call with the radiologist, who identified a retained laparotomy pad in the midline of the abdominal cavity.
Let's see the oblique film, Rob. Ah, there it is.
I can see it now. The oblique view is not subtle. It's definitely in the midline. Okay, David, let's find it and get it over with.
Okay, Amy, can I have a Richardson retractor?
Richardson retractor.
Make it two, please.
Richardson retractor.
Thank you.
Yep, here it is. It was rolled up like a ball between two loops of small bowel. That's probably why I couldn't feel it.
Here it is.
Excellent.
All surgical items used in the surgical field should be detectable by radiograph when available and whenever possible. Such surgical items commonly used in the operative field are 4x4 sponge, 4x8 sponge, laparotomy pad, surgical towel with radiopaque marking. The radiopaque marking in the surgical towel should be evident to the surgical team. A blue towel with blue radiopaque tail, a white towel with radiopaque blue tail, a white towel with radiopaque marking in the side. It is generally not recommended as good practice to use 4x4 or 4x8 sponges for surgical procedures in large body cavities, such as the chest and the abdomen.
Well, finally. Are we okay now, Rob?
Yep, we're good.
Okay, David, I'm out of here. Call me if you need me, okay?
Dr. Albo, could we do a quick debriefing of this case before you leave? We can do it while they're closing, and it'll only take a couple of minutes.
Sure thing, Rob. You're right.
To prevent the retention of surgical items in operative procedures, the following steps must be implemented. 1. Consistent implementation of standardized practices for counting sponges, sharps, and instruments. Guidance from the VA Directive Prevention of Retained Surgical Items is recommended. 2. A methodical wound exploration using visual and tactile senses prior to wound closure, and this should be repeated whenever a surgical item is missing. 3. All items used on the surgical field should be detectable by radiograph when available at all times. 4. An intraoperative radiograph must be taken in timely fashion when a surgical item is missing with an unreconciled count or when instruments are not counted. And 5. An intraoperative radiograph must be reported by the radiologist to a member of the surgical team, person to person, within 30 minutes of the request.